In a bid to improve health services in Bududa district, the hospital management, together with other stakeholders, have established a private facility that shall help address the challenge of those community members wishing to get private medication elsewhere. The facility was launched today by the RDC for Bududa district, Juliet Salome Amara, and according to her, this is the first of its kind and is ready to offer specialized services to its clients, adding that the facility is not only for the community members, but for those who do wish to get private services.
It is not only you, the community, that use the facility. Even DPC, Chairman 5, we use them. We don't just bring them here for the community. And I want to assure you, this is a standard, even the legal standard. So I want to thank you, Manabi, and I want to take this opportunity to officially launch that private wing on behalf of the government of Uganda, and to also say that keep supporting the president, keep supporting government programs, because this is the only way we can move ahead.
Bududa Hospital serves a population of over 250 people from the districts of Manafa, Namisindwa, Mbale, and many other places. According to Patrick Nabutanyi Makale, the chairperson Health Management Committee for Bududa Hospital, said this was a demand-driven initiative from the locals themselves, which they had to undertake as management so as to address the gap.
The community we are representing demanded that they should have a facility where instead of going to the quack doctors, they should have something which is legalized. And when we shared that one with the medical team, yes, we presented it to them, and then they bought the idea, because this one is something which was thought of collectively. Even the working class of Bududa, they also said, no, but why do we move from here to go to Mbale, to go to Jinja, to go to Soroti, when a facility like this one can even be born around our district? So this is the idea which was collected, and that's why we thought about it.
Dr. Sylvian Tegeka, the medical superintendent for Bududa Hospital, allayed fears of those who think government services shall be underlooked now that the private wing has been established.
So this private wing comes in not to actually substitute the government side. We are going to be working alongside. The private wing will not affect the services that are being provided on the government side. So for those who feel that they need a quicker service and they need to pay, they can pay something little for it. This is why we have started with a private wing. And what this means for the people of Bududa and the surrounding areas is that there are many people who would want these services to be provided for them, but they have to walk longer distances to get these services. So we come in as an answer to them. We can provide these services. We have the availability of health workers with the quality of care that the clients need.
Dr. Alex Mushisokakala, the district health officer for Bududa district, said this is going to help fix the gap of other health services which were missing in Bududa Hospital.
We have had many of the people from Bududa district who go to Mbale and even other districts looking for some of the services which may not be available under the public or the government services which are funded. So now we have started this private health services here. We shall have in the OPD, for example, our patients, when they are coming, they start to be seen by a clinical officer, for example, and then it is a few, because of the numbers, who get the chance to be seen by a doctor. Now in the private wing, all our patients, the first manager is going to be a doctor, so those are improved services.
Residents whom we spoke to hailed the management for setting up such a facility, asking the government to expedite the process of improving on Bududa Circular Road, since the facility is going to serve people from different districts.
Have been missing services of specialization. Now that we have this, we are going to these specialist physicians will be on call. Now that we have officially opened this private wing, we implore government to improve on the road network, particularly this circular road, because Bududa district is all round, and this hospital doesn't serve Bududa alone.
Kwasimira nabi mungiri chikwama kulonjinga private wing yefe yelidwalo lye Bududa kwama kuba kwabona nabe kisera shimala nga kusutaka mpesi khotsa Mount Elgon khotsa muchua ni ali sai khwatuyire bufuba khwatuyire shifo shirai sheso khuli khutsa nga waberekho ni khapesi kho watima watsaolao bakhujanja bamuwangu era wafuna service ilindai era kusema management yelitwa liye Bududa lweko mulimo kuno atenga nakho kupirisa ni batuta at large ndali sai ngabe wafune bulwalo khalwa no mala kampesi ko khaira Mount Elgon khakapamala khuba khalwa no mala kampesi ko khaira muchua ni mubisinza bindi bifane ngebyo ta itse Bududa private wing khufune bujanja era nafuna bujanja bibulai.
Much as there is always the supply of medicines on quarterly basis, the medicines that the government supplies in these facilities may not be enough and sometimes may not address most of the diseases that most people suffer from, something that makes private medication inevitable. This is yet another milestone that Bududa District Hospital has registered after the hospital laboratory acquiring an international accreditation, something that makes the health services in Bududa District Hospital recognized internationally. This is Andrew Nahabaya here in Bududa District.